Hi there, I'm Dr. Rich Besser. I'm President and CEO of the Robert Wood Johnson Foundation, and I am really thrilled to be here with you today to try and answer some of your questions. No guarantee I'll have answers to all of them, and when I don't, I'll let you know that. A little bit of my background that may influence the questions you want to send my way. The Robert Wood Johnson Foundation is the nation's largest philanthropy that's focused on improving health in America. I've been here for about 4 years. I'm a general pediatrician and an infectious disease epidemiologist, and I spent 13 years at the CDC working on control of infectious diseases, as well as leading the work there on emergency response. And I am ready and willing to take your questions. So the first question, the CDC released new mask guidance last week. As business owners, how are we supposed to verify vaccination status to know who should be wearing a mask or not, both for employees and customers? You know, this is a really challenging area, and different states and localities are approaching it in different ways. First, you know, the science behind the CDC recommendations is strong. And it's exciting. It's one of the things that gives me optimism. What the CDC is seeing across the nation is that in every state right now, the number of cases, hospitalizations, and deaths is going down. And in many places, it's going down pretty dramatically. They're also seeing that there is now enough vaccine supply so that everyone in America who's 12 and older who wants to be vaccinated can be vaccinated. Still a lot of work to remove barriers to vaccination, but there is enough supply. They're seeing that in the real world, these vaccines are performing incredibly well. They're among the best vaccines we have for any infectious diseases. So not only did they perform well in the trials that led the FDA to authorize their use, in the real world, these vaccines are performing at above 90% for preventing severe disease, hospitalization, and death, which is what we're really trying to do with these vaccines. And then the last piece is that it's very unlikely that people who are fully vaccinated, meaning 2 weeks after their final dose, will spread this virus to other people, even if they are infected. So the recommendations may make sense, but from a business perspective, it poses challenges because there is no gold standard system in the US to verify vaccination. Some states have put in place programs, apps, software, so that you can ask to see someone's vaccination status. But I know that most businesses don't want to be putting their workers into the role of being vaccine police. I know some sports stadiums are requiring proof that someone is either vaccinated or is negative for COVID. But many businesses are saying, you know what, we're going to continue to require masks indoors in our business setting. Part of this is to protect workers. While there is enough vaccine for everybody, it hasn't been as long that younger employees in particular have had access to vaccination. And so many businesses want to provide more time for that. And I think that what we're going to see is that will depend on the business whether or not they say, okay, we're going to go with an honor system, and people who come in who are not vaccinated should be wearing masks. People who come in who are vaccinated don't need to wear masks. And it's up to the individual to enforce that themselves. Over time, if the number of cases continues to decline and declines to levels like we see with the flu, then it becomes more of, well, do we go back to treating life like we did during the days of flu, where you asked people to stay home if they were sick, or to cover their mouth if they were sick, but you didn't look to businesses or anyone else to enforce behavior. So here's the next question. The pandemic has disproportionately impacted people of color in many ways. What can we do to create real equity in our health systems now and beyond the pandemic? This is a critical issue. When you look at the pandemic, it has affected every community, but it has not affected every community in the same way. Black, Latino, Native Americans have been hospitalized, have been infected, and have died at rates that far surpass the proportion of the population. And the largest reason for that is differences in exposure risk. Who is it who is more likely to be working in jobs that are on the front line, jobs that are essential? Who is more likely to work in jobs that pay less and have less wealth and resources to fall back on, so that if someone is sick or concerned about the workplace, they're able to stay home. For many people in America, they've been forced during this pandemic to make a decision between going to work to put food on the table and pay the rent, or staying home at times to be able to protect themselves, their families, and their communities. Going forward, we have to look at the policies that are in place that provide different opportunities for people by race, by ethnicity, by neighborhood. And we have to look to say, what kind of a nation do we want to be? The American Rescue Act plan, which was passed a couple months ago, provides additional resources to people, and by an estimate by a study by the Urban Institute, could reduce childhood poverty by 50%. That's really exciting. But when you look at what's in that bill, a lot of it is time limited. Expansion in terms of food support to families, expansion in terms of income support to people who are unemployed, child tax credits, these kinds of things, which can really change the course for people, are critically important. And now, as we're emerging from this pandemic and we think about what will it take to get people back to work and provide opportunity, one of the areas we have to look at very closely is care, child care, adult care, elder care. What are we providing in terms of resources? What do we say about those jobs in terms of the salaries that are paid, and who's bearing the brunt? When you look at the economic toll of this pandemic, just like the disease toll, it's not been felt equally, and the economic impact has been felt much greater by communities of color, and in particular, women who are in the workforce. Women of color, more than white women, but women across the board have seen a higher rate of unemployment, and are seeing far more challenges in getting back to work. Because while the number of cases is going down and people are getting vaccinated, childcare is still a major challenge, and women in our nation provide the great majority of child care, elder care, care to people with disabilities. And if we're not seeing children back in school, that makes it much harder for women to enter the workforce. If we're not seeing care jobs paying a living wage, it will be much harder to get people into those jobs to provide the care that we also desperately need. So there's a lot of work to be done across the board. It's not just about health. One thing that I would like to see is universal health care. The idea that we're in a pandemic, and when we started this pandemic, over 25 million people lacked access to high quality, comprehensive, affordable health care. And for millions more, the cost in terms of copays and deductibles really put the insurance that they had and the health care that they had out of reach. That's something we need to see, and we need to question whether this is something that should be provided through people's jobs, or whether it's something we believe everyone in America has a right to. So next question, with restrictions being lifted, is it safe for elementary school students to attend school in person without a mask? So right now I would say no, that's not a good way to go. As a pediatrician, one of the things that strikes me is that the toll of this pandemic, while in terms of cases, hospitalizations, and deaths, it's been much lower on children. Thankfully, children are much lower risk of severe disease. They're still at risk, and they've been hit very, very hard. They've been hit hard in terms of emotional health, in terms of mental health. Tens of thousands of children have lost parents, and millions of children have lost the access to in-person learning. The importance there, not just in terms of what they learn in terms of facts and education, but in terms of their socialization, their engagement with other children. Children with disabilities, with learning disabilities, who've been lacking the services that they would normally be getting in school. And so when you think about kids coming to school and doing it safely, we have vaccines now for everyone 12 and up, but we don't have vaccines for children younger than that. And the current recommendations are that children do wear a mask in school, any child over the age of 2. Below that, it's not a safe way to go. It's expected that there will be vaccines for younger children in the future. And the question there will be looking at, well, what is the benefit from vaccines at that point versus any potential risks at that point? Children also play a role in terms of disease transmission within families. And so while a child may be at much lower risk of having severe disease, children don't live alone, at least most children, thankfully. They live in a family. They live with others. And some of those others they live with are at greater risk of severe disease. There are people who want to get vaccinated or have gotten vaccinated, but because of their underlying medical condition, maybe they're being treated for cancer or some other condition, aren't going to have the same response to vaccine. Making sure that children aren't getting infected and putting others at risk is another important thing here. So masks is really important for now. We're learning that that's not the only thing in schools. Schools need to focus on ventilation. Opening the windows is a big help. But I think it's truly possible this fall for every child to be in America to be in class learning in person safely. We have to be committed to doing that and recognize that how we fund schools in America is not equitable. Schools are funded in most places off of property taxes. And so schools with the lowest resources, schools in the lowest income neighborhoods are going to need more resources. And there were resources in the American Rescue Plan Act, but we want to make sure that those resources are getting to schools so they can make the changes that are necessary so that every child can get to school in person. So how soon do you think we'll have approved vaccines for children under 12? It's hard. That's hard to say. The way the system works, the Food and Drug Administration sets standards, what they want to look for in terms of vaccine approval. And there is an advisory committee to the Food and Drug Administration. They're going to be meeting in June to talk about vaccines for young children and what they want to see. What will be the standard for them to recommend approving vaccines in young children? I think that it will be very important, just like with vaccines for adults and older children, that they're shown to be safe and they're shown to be effective. But if the disease burden in very young children is extremely low, what else will the committee want to see as they're thinking about recommending vaccines for approval for very young children? And I think they're going to want to look at issues of transmission to others. And the broader burden of this disease on very young children. So what would you say to parents who are hesitant to give vaccines to their kids due to how it might affect their future development? I would say that we have been, as a pediatrician, I've been vaccinating children since the 1980s when I was in training, and my own children are fully vaccinated. But it's very hard to answer a question about what if in 10 years, in 20 years, because until that time has passed, you can't definitively answer any of those questions. But what you can say is that these vaccines, as they've been given to hundreds of millions of people, have shown to be very safe, and that there's nothing in these vaccines in terms of how they're manufactured, how they act on the body, that gives any kind of concern that these will have an impact on childhood development. What we are concerned about is the impact of COVID and COVID infection. What we're seeing is that so far, several hundred children have lost their lives to COVID. But several thousand children have developed inflammatory conditions after having a COVID infection. And we don't know the long-term consequences of that. We don't know the long-term consequences of asymptomatic or mild COVID infection. And so as you're thinking about whether or not you want to get your child vaccinated, think not just about a theoretical risk from a vaccine, one that hasn't been raised from any of the science around these vaccines. Think as well about the known risk from this infection, and weigh those two things. I don't think anyone should be coerced here. It's really important that parents bring their questions to people that they trust. For many parents, that's their pediatrician or family doctor or nurse practitioner, and get your questions answered so that you can make an informed decision on this. Do you think we'll be able to reach herd immunity in the US? If so, when, and what will it take to get there? So let me just first start off by saying a little bit about what herd immunity is. Herd immunity is a concept in infectious disease and public health. And what it says is that if enough people in a community are either vaccinated or have had a particular infection, if someone comes into that community who is infectious, that person is not likely to bump into someone who is at risk. And so the virus that may be living in their nose has nowhere to go. And so even if there are people in that community who are not vaccinated and haven't been infected, it's most likely that the infectious person will bump into someone who is protected, and the virus won't spread in a community. The level of immunization or natural infection you need to see in a community to reach that, what's called herd immunity, varies based on a number of factors, but primarily it's based on how contagious is a given disease. The more contagious it is, so something like measles, which is really, really contagious, you have to be above 90%, maybe 95% of people in a community vaccinated in order to reach herd immunity, so introduction won't spread. For COVID, it's not totally known. It isn't known what that level is. We've been talking about 70%. But the critical piece to realize here is that the herd immunity functions at the individual community level. So as a nation, we could be at 70%, and say 70% is the right number. We could be 70% of people in America are fully vaccinated. But if that 70% isn't spread evenly over every single community in America, you're going to see some communities that are at 80, 85%, and some communities that maybe are at 50%. So a community at 50% will still be at risk. The one at 85% won't be at risk. So I don't find it very useful to talk about this figure of herd immunity. I think it's more important to think about this, and that's that every single person who rolls up their arm and gets vaccinated not only gets protection themselves, but they contribute to protecting their family, their friends, those in their community, every single person, because you all of a sudden become that barrier to spread in your community. And I find that this talk about this mythical number and this focus, especially on statistics for the nation as a whole, is a distraction. Because if you break it down, what you're seeing right now is wide ranges where many states have high levels of vaccine coverage and many states have low levels of vaccine coverage. And those states where it's low will be at greater risk for introduction. But we also don't have a good picture of what percentage of people in any community have actually already had COVID. We don't think that a natural infection, having had the disease, will give you protection for as long and as strong as the vaccine will. But it will likely provide some community protection, at least in the short run. Next question. What would you say to someone who is afraid to get the COVID-19 vaccine? What I would say is get your questions answered. There's a website. There's a lot of places to go for information. There's one called getvaccineanswers.org that has terrific information on vaccines around all the products that are out there, and is a good source of science-based information. The CDC website has terrific information. But talk to your own trusted sources. So your doctors, your nurses, those who you trust for health decisions. What I'm seeing is that there was a large group of people who were waiting, and as soon as vaccines were released, were getting in line. And so we saw a challenge where people couldn't get appointments. And then we were seeing, as the vaccine supply ramped up, we were seeing 2, 3, even 4 million people in a day getting vaccinated. And that big pent up demand has been met. Now we're seeing much easier access, but in some communities, it's hard. There's a big role businesses can play there by giving workers time off to get vaccinated, giving workers sick leave so that if they're feeling lousy the day after vaccine, they're not going to forgo their paycheck. Some businesses having on-site vaccine clinics. There's data to show that workers really like that. There's some businesses that are giving small incentives, a gift card to get coffee, or some other small token to encourage vaccination. Those things help. But there's also a group of people who, as they're having friends and family members who've gotten vaccinated, and they get a better sense of what their friends and family members' experience has been, and they're seeing just this incredible psychic, emotional release of knowing that once you're vaccinated, you don't have to worry. Knowing that when your teenagers are fully vaccinated, they can go out and just be teenagers. That there's a real relief from that we're seeing demand is continuing to increase. So I'm hoping, it's not that we're not going to see those 3 and 4 million vaccine days again, but I am encouraged that we are going to see slow, steady increase in the number of people being vaccinated as people get their questions answered. So what should we do if not all of our workers get vaccinated? Should we plan to permanently maintain masks and distancing to account for unvaccinated employees and variants? This is a challenge, and I'm hoping that OSHA, which creates a lot of workplace standards, will provide guidance on this. Different businesses are coming at it in different ways. Flexibility is something that workers like to see, and most businesses are looking to provide. Some depends on the type of work that people do. Is it something that can be done remotely, or is it something that needs to be done on site? And if it is something that needs to be done on site, is there the opportunity for every worker who wants to be vaccinated to be vaccinated? Are there protections in place so that someone who may have a disability that prevents them from getting vaccinated so that they're safe and not relegated to working remotely if they want to be on site? There are a lot of factors here to weigh. Our foundation is thinking about what work will look like when we come back to our building. We've been working remotely since March of 2020. We're engaging our staff in those conversations. What is it that they would like to see? And we're fortunate that in the line of work we do in philanthropy, we can work remotely. So we are not going to require that any of our staff come back to work physically this calendar year, except for those workers who are involved in maintaining the facility, who have to be in the building. For others, we'll likely have some kind of a hybrid where there are people who will continue to work remotely, and there'll be staff who come into the building. And we'll be looking and thinking about the mask guidance that CDC has put forward, what our state has in terms of their rules and regulations, what public health is saying we should be doing at the local and state level. And all of that will go into the decisions that we make. But I know a lot of businesses are wrestling with this, what to do in terms of vaccine requirements, vaccine encouragement, and policies around masks and social distancing. So what is the role of the United States in ensuring global control over the virus? Thanks very much for that question. This is critically important. As we in the United States are looking for ways to encourage everyone to get vaccinated, and as we're looking to encourage those young people 12 and older to get vaccinated, we have to recognize that in most of the world, vaccines are not yet an option. There are healthcare workers all over the globe who are going to work who are unvaccinated. The United States has has a critical role to play in terms of global vaccination and global control. And there are many reasons. One is the ethical, moral, humanitarian reason. As one of the wealthiest nations in the world, we have a responsibility to help support countries with fewer resources. From a perspective of national self-interest, it's also critically important. There's been so much news about concerns of variants. One thing about viruses, when they reproduce, they make mistakes when they reproduce, and those mistakes can lead to viruses that are slightly different than the viruses that are out there right now. If you get a change to the virus that is significant, it's possible that that change will lead to a virus circulating that the current vaccines do not cover. Thankfully, that hasn't been the case yet, but it's very possible. We see that very frequently with the flu. That's why each year when we get a flu shot, it's slightly different. If this were to happen for COVID, we would be back to square one, and we would need to be vaccinating people again. And that's something we can help avoid by working to control COVID wherever it is. Spread of COVID anywhere in the world is a threat to people everywhere in the world. And we have a critical role to play. And I'm seeing a little more movement in that direction. But I think as a nation, we have a lot more to do to try and help control COVID spread everywhere. All right, so this next question, this question here is the last question we're going to have time for. What are you optimistic about in the next phase of the pandemic? I am incredibly optimistic, and a number of things give me optimism. I'm optimistic because the cases around the United States continue to go down. People are continuing to get vaccinated. We're seeing vaccines that are there for younger and younger people. We've learned that people who are fully vaccinated are very unlikely to spread this to other people. And we're reaching the point of where more and more of our activities can be outside. And we've learned that outdoor activities without a mask are incredibly safe. And so I'm hoping that over the course of this summer, people will continue to get vaccinated. Businesses will figure out how they're coming back in person, and we're going to see this get down to levels that are so low we can change how we're approaching this. It doesn't mean that in the fall it couldn't come back, but what it says to me is that our economy now has an opportunity to rebound. We need to do everything we can as a nation to make sure the next time there's a pandemic, we don't see the same disparate impact that we've seen with this pandemic. And we need to work towards a day where every day in America isn't a crisis for millions of people. With that, I'm gonna stop. I want to thank you for joining me today for your terrific questions. You can follow me on Twitter at Dr. Rich Besser. You can follow our foundation at RWJF. Thank you very much for your time, and have a really good day.